Athletes, we need to have a conversation about caffeine as a supplement. Caffeine is the most widely used drug in America. Yes, it is considered a drug because by definition, a drug is anything that changes the function or structure of your body or mind. Think of how people may change their habits or their personality when they've had coffee in the morning. I think when people think of caffeine, they most likely envision coffee or soda, but caffeine is found in a lot of different products, from tea to over-the-counter medications, and I'm sure some of you have also taken things like pre-workout before any kind of training or competition. The highest concentrations of caffeine in your blood happen between 45 to 60 minutes after consuming it, but it can be detected by the body within 15 minutes, and this is regardless of the amount that you take. Athletes use caffeine as a supplement because it has been found to improve athletic performance. Let's talk about some of the benefits of caffeine, like increased metabolic rate, which may help athletes lose or maintain weight. Research has found that caffeine increases heart rate, both at rest and during exercise, as well as blood pressure. There's been seen to be benefits for endurance athletes, as there's an increase in resting cardiac output and stroke volume after consuming caffeine. Smith, Ryan, and Antonio indicate that it has been well documented that caffeine ingestion results in improved endurance performance, including exercise at 70 to 75% of your VO2 max for 15 to 125 minutes. It is also found to postpone fatigue or reduce the rate of perceived exertion, basically how tired you feel, increase alertness, and improve reaction time. What athlete doesn't want to have better reaction time, more alertness, and fatigue slower? Strength and power athletes. Caffeine has some positive effects, but it's not as prevalent. Studies show that has more of an influence on the number of repetitions completed in a time frame, more so than the muscular strength. So that would be more endurance over strength and power. Some of the disadvantages of caffeine include anxiety, restlessness, and headaches, which may impair your performance. Also, being that caffeine is a drug, it's been found that over time, in order to achieve the same effects, you will continually need to take more and more, because your body begins to adapt to it. Speaking of how much you should take prior to a practice, it's been seen that a dose of 3 to 6 milligrams just 60 minutes prior to exercise has potential benefits per performance. Anything more or less than that doesn't show as significant of changes in performance. While it does improve performance in various athletes, based on research, caffeine has more benefits for endurance athletes. It's also important to note that caffeine is considered a banned substance in the NCAA because it's a stimulant.